For those who have been newly diagnosed with breast cancer, the conversation with the patient's healthcare team will often turn to treatment options, and that may include the possibility of a mastectomy or a lumpectomy. This morning on Ask a Specialist, we're talking about what you need to know with Dr. Kathleen Ma, a breast surgical oncologist with the Queens Medical Center. Aloha and good morning, Dr. Ma. Thank you for joining us.
Good morning. My pleasure.
First, what is a lumpectomy and how is that different from a mastectomy?
So a lumpectomy versus mastectomy implies removing the entire breast. A lumpectomy is best for smaller tumors if we can take out the tumor with normal tissue all the way around it. It's usually paired with radiation following surgery, outpatient, quick procedure. Patients can go back to work the next day, and usually, depending on the size of the tumor and the patient's breast size, very little disfigurement, especially with newer oncoplastic techniques.
Does a bigger surgery such as a mastectomy offer better outcomes?
Great question, because I get this asked a lot. Back in the day, we only had one surgery to offer patients, and that was a mastectomy. But over the years, as we've gotten better with our screening, we're finding 75% of the time women have cancers that they wouldn't have known about unless they had a mammogram. So small little tumors, and we asked ourselves, do we really need to be removing everybody's breast for small little tumors? So we did a clinical trial was done many, many years ago. Taking out the piece of the tumor, radiating the breast that gets left behind, comparing that to the mastectomy group and following them for many, many years. And at the end of that clinical trial, we found out that lumpectomy and radiation compared to mastectomy was equal. So no, you do not have to do a mastectomy, and mastectomy does not necessarily, a bigger surgery doesn't mean you're going to do better from your cancer. Both surgeries, lumpectomy, radiation versus mastectomy, had equal outcomes. So that was a huge landmark trial. Sometimes, having said that, patients need a bigger surgery. If their tumor is bigger, if their breasts are very small, if they have multiple tumors, sometimes people have a smaller tumor and they don't want radiation, or they might want reconstruction, then they might opt for a mastectomy. But we have more options for patients now. So bigger surgery doesn't mean better outcomes.
If a patient does choose a mastectomy, do they still require chemotherapy?
Good question. The decision for chemotherapy is made separate from your decision for what surgery you want. So whether you had lumpectomy, radiation, or mastectomy, the decision for medicine after that or before that is made separately. So really the decision for chemotherapy is going to be made on the biology of the tumor. And I like to use the analogy of a personality. We have a cancer, and then just like people, we have nice personalities and aggressive personalities. So sometimes patient might need a pill, sometimes patients might need chemotherapy, sometimes they might need chemotherapy with immunotherapy. So the decision for your surgery is made separate from whether you need chemotherapy or not.
Okay, and lastly, if a patient has cancer in one breast, can it jump over to the other one?
Not usually. So we always tell, usually when people walk into my office, they're like, take off this breast, and while you're at it, take off the other breast. No need. The risk to the opposite side is very small, usually quote 3 to 5% over a 10-year period. So it's not like if you have it on one side, it's going to jump to the other side. We have very good imaging, screening mammograms, making sure you're seeing your doctors every year, doing your own monthly self-breast exams, and we've gotten pretty good at finding cancers very early. So no need to do anything drastic to the normal breast.
Okay, and to learn more about the services provided by Queens Cancer Center, you can visit www.queens.org, click on services, and then click on cancer. Mahalo, Dr. Ma. Appreciate you joining us this morning and for all the information.
Thank you.
Have a great
good
day.
day.